Let's warm up for Micro 22. First question, what pathology fits each of the following high-yield statements? So opacity seen on X-ray on both sides of the carina. So when you see bilateral hilar lymphadenopathy in the chest, think about sarcoidosis. Next one is dermatitis, diarrhea, and dementia, which are the 3 Ds of pellagra, which is a niacin deficiency, a vitamin B3 deficiency. Sometimes it can result in death, which is a 4th D. Greenish rings around the periphery of the iris are the Kaiser-Fleischer rings seen in Wilson disease. Elastic skin and joint hypermobility, that's Ehlers-Danlos syndrome. Enlarged, hard left supraclavicular lymph node, that's called Firkos node, which suggests an underlying visceral malignancy, commonly stomach cancer. And the last one, which hormones share a common alpha subunit? You have TSH, LH, FSH, and HCG. All right, let's move on to the lecture.
Hi, once again, I'm Dr. Jennifer Shuford, and in the next 2 videos, we'll be discussing RNA viruses. There are a lot of these RNA viruses, and it's important for you to have a good grasp on them. In this video, we're going to cover reoviruses, the picornaviruses, the caliciviruses, the togaviruses, and the coronaviruses. So let's get started. We'll begin with the reovirus family. There are 2 reoviruses that you need to know, rotavirus and cultivirus. First, let's talk about rotavirus. This is one nasty virus. Like all the reoviruses, it is a non-enveloped icosahedral RNA virus with double-stranded RNA. The terrible thing about it, though, is that it's the primary cause of fatal diarrhea in children around the world. Of all child deaths under the age of 5, rotavirus alone is responsible for about 6%. Why do you think it's so deadly? Well, it causes severe diarrhea and vomiting, which leads to dehydration and electrolyte abnormalities. So these are real causes of death in these little children. Now, in temperate climates, like here in the United States, the outbreaks usually occur in the winter months and are often seen in daycare centers and playgroups. So look for these clues in test questions. So remember winter months. Oh, did it just get cold in here? Huh. So that's it for rotavirus. Now let's move on to the other reovirus that we were going to highlight, which is cultivirus. Cultivirus causes something called Colorado tick fever. This is easy to remember, COL for Colorado and TI for tick. So cultivirus causes Colorado tick fever. It's found in the mountainous regions of the western United States and Canada. It's spread by the wood tick, so you see it in outdoorsy people, hikers, fishermen, campers, and the like. It causes an acute, self-limited flu-like illness, and no specific therapy is recommended. Okay, let's move on to picornaviruses. They're pico-RNA viruses. They're RNA viruses that are very small, very pico. Included among the picornaviruses is a particular genus called enterovirus. Enteroviruses cause a huge amount of human disease and suffering, so let's talk about them. Human enterovirus is further divided into different species and serotypes that may sound more familiar to you. They include polioviruses, Coxsackie viruses, and echoviruses. Now, the word enterovirus can refer to the genus or to a species within that genus. So don't let that confuse you, even though it does still confuse me. Now, these are called enteroviruses because they're spread primarily through the enteric system, through fecal-oral spread, but they can also be spread through respiratory secretions. All right, so let's talk about poliovirus. Poliovirus infects the gray matter of the anterior horn of the spinal cord and the motor neurons of the pons and medulla, which is how it can cause that paralysis that polio is known for. Thankfully, poliovirus has been controlled in the United States for many years due to the success of the Salk and Sabin vaccines. So let's talk quickly about these vaccines. The Sabin vaccine is the oral form, and it's a live vaccine. You can remember this by thinking of the disco song, Stayin' Alive. In this case, though, it's Sabin alive, Sabin alive. Now, the Salk virus is injected, and it's a killed vaccine. You might be able to remember this by remembering that the K in Salk stands for killed. Polio continues to be a problem in other parts of the world, so it's good to know a little bit about it. Now let's move on to echovirus. Echovirus is a common cause of aseptic meningitis and myocarditis. It can also cause upper respiratory tract infections in the summertime. So if you see a question with an outbreak of aseptic meningitis during the summer months, definitely think about echovirus. Wait, now it's hot. Some of the summer outbreaks can be so large that not all of the patients can be cared for in the hospital setting. Remember that viral meningitis is not as severe as bacterial meningitis, and so management doesn't have to take place in a hospital. Thanks to advances in laboratory technology, we can detect enteroviruses, including echovirus, with PCR of the CSF, which allows more rapid and definitive diagnosis of viral meningitis, and it saves us from using a lot of unnecessary antibiotics. Okay, now onto Coxsackie virus. So Coxsackie virus also causes aseptic meningitis and myocarditis, just like echovirus. It also frequently causes herpangina, hand, foot, and mouth disease, or other febrile pharyngitis presentations. What you see with hand, foot, and mouth disease are vesicular or papular lesions on the palms and soles. So if you see a picture of this on a test, think of enteroviruses, specifically Coxsackie virus for hand, foot, and mouth disease. And then other diseases that you should remember with Coxsackie virus are myocarditis and pericarditis. Viral myocarditis is fairly uncommon overall, but a common cause of viral myocarditis in the United States is Coxsackie virus. And then the last of the picornaviruses is hepatitis A virus, which is covered with the other forms of viral hepatitis. So how is hepatitis A transmitted? Fecal oral. Hepatitis B and C are the ones that are transmitted sexually or by blood. Hepatitis A and E are the fecal oral ones. Now let's look at rhinovirus. Rhinovirus is also a picornavirus, but it is not an enterovirus, and is one of the two common causes of the common cold. The other one is coronavirus. There are about 100 different immunotypes of rhinovirus, which is why you can get a cold every single year of your life, even multiple times a year if you're lucky enough to be around school-age children like me. All right, those are the main picornaviruses. Now let's move on to another family of RNA viruses, caliciviruses. The calicivirus I want you to know about is norovirus. Norovirus is another major cause of viral gastroenteritis. We just talked about one with kids, which was rotavirus. Well, norovirus is another one. It usually involves vomiting and diarrhea. These are well known for point source outbreaks, where one person initially gets it and then can spread it to multiple people around them. These are the viruses that are responsible for diarrheal outbreaks that you hear about on cruise ships and in nursing homes. Oh, well, looky there, how convenient, the norovirus cruise ship. Norovirus is spread through fecal oral route primarily, but vomitus appears to spread the virus quite nicely as well. The next family of viruses is the flaviviruses. Flavi means yellow, and this group is called flavivirus because one member of the flavivirus family causes yellow fever. Another flavivirus is hepatitis C virus, and you can remember that with hepatitis C you get jaundice or yellowing of the skin. We're not going to talk anymore about hepatitis C virus here because we cover that elsewhere in the course, but we are going to talk about these other flaviviruses. Let's start with yellow fever. This is a big deal. It is fatal in up to 50% of cases. Most of these flaviviruses that we're going to discuss are called arboviruses because they're arthropod-borne viruses, meaning that they're spread by mosquitoes or ticks. Yellow virus fever is transmitted by the Aedes mosquito, and both humans and monkeys are natural hosts. Where do we find yellow fever? Primarily in sub-Saharan Africa and South America. Clinically, what do we see with yellow fever? Remember, high fever, hemorrhagic disease, and jaundice. So first comes the high fever, headache, and prostration. Then comes the hemorrhagic diathesis and jaundice. And the hemorrhagic manifestations include hematemesis, epistaxis, gum bleeding, and petechial and purpuric skin lesions. Now, the vomit may appear black because of that dried blood, what we call coffee ground emesis. The jaundice occurs because of liver damage, so you will see a rise in the transaminases as well. Yellow fever is a vaccine-preventable disease, and travelers to countries where yellow fever is endemic or to surrounding areas are often required to provide documentation of vaccination. The next flavivirus is dengue virus. There are 4 serotypes of the dengue virus, and they cause dengue fever. Let's look at your study guide here. Dengue is a very common mosquito-borne viral illness worldwide, possibly the most common one, with a rising prevalence due to overcrowding in endemic areas. Currently, there are more than 50 million cases per year worldwide, so it's hard to believe that incidence could possibly be on the rise. Disease severity ranges from mild all the way to life-threatening. Dengue is often called break-bone fever because of the severe musculoskeletal pain that accompanies this disease. It's also associated with severe headache, especially retroorbital pain. So if you see a question that mentions a fever, severe musculoskeletal pain, and retroorbital headache, definitely think of dengue. Now, the most feared complication of dengue is dengue hemorrhagic fever. This hemorrhagic complication doesn't happen frequently, but when it does, it's life-threatening. And something else that might come up in a test question about dengue is the tourniquet test. A tourniquet test is a World Health Organization field test for dengue hemorrhagic fever. So the blood pressure cuff is inflated in a patient up to the point somewhere between the patient's systolic and diastolic blood pressure, and then you leave it there for 5 minutes. And if there are excess petechiae, then that indicates increased capillary fragility. Now, in resource-rich settings, we just check for thrombocytopenia with a blood test, but if you don't have that luxury, then this is a readily available way to check for thrombocytopenia of dengue hemorrhagic disease. The next flavivirus I want to cover is West Nile virus. West Nile virus was first seen in the United States in 1999, and since then it has swept across the country and it's become endemic. Let's look at your study guide for a few high-yield points about West Nile. Birds are the amplifying hosts. Mosquitoes bite the birds and then transmit the virus between them. Mosquitoes then act as a bridging vector for humans. They pass the virus from birds to humans. Humans are incidental hosts. Our viremia isn't a high level or prolonged enough for us to transmit the virus onto another person through a mosquito. When West Nile virus infections are symptomatic, they're usually acute flu-like illnesses. Symptoms often include fever, headache, malaise, back pain, myalgia, and anorexia for about 3 to 6 days. Anytime we say flu-like illness, these are the sort of symptoms that we're talking about. So West Nile virus often causes an acute flu-like illness, but in about 1 to every 150 infected patients, you can see severe neurological symptoms. These symptoms include meningitis, encephalitis, muscle weakness, and/or flaccid paralysis, because this virus also infects motor neurons in the anterior horn. What was the other virus that did that? That's right, poliovirus. You can have alterations of consciousness, possibly even death with West Nile virus. So West Nile virus usually causes an asymptomatic or mild self-limited disease, but occasionally it causes very severe disease that can result in paralysis and death. How do we diagnose West Nile virus? We can check for IgM against West Nile virus either in the serum or the CSF. IgM is big and it doesn't cross the blood-brain barrier. So if it's in the CSF, it indicates acute disease there. Lots of people have West Nile virus IgG because lots of people have been infected with this virus by now. So it's important to look for IgM if you're considering West Nile virus infection in your differential. Just so you know, a lot of labs are using PCR to look for West Nile virus RNA in both serum and CSF, but these tests aren't FDA approved yet. Treatment for West Nile virus is supportive at this point since we don't have any antivirals that show good activity against the virus. Then the last flavivirus I want to mention is St. Louis encephalitis virus. This is a flavivirus that causes encephalitis. Now there are several other RNA viruses that also cause encephalitis, like Eastern equine encephalitis virus, Western equine encephalitis virus, and California encephalitis virus. The only thing that I think that you really need to know about these viruses is that they are all arboviruses, which again is a virus that's carried by an arthropod vector that can then cause encephalitis. All right, moving on. The next virus family is Toga virus. One of the members of the Toga virus family is rubella virus, which causes rubella, also known as German measles. Symptoms are usually mild and include fever, lymphadenopathy, arthralgias, and a maculopapular rash, like what you see here. If a pregnant female contracts rubella, you may see congenital rubella syndrome in the baby, which often manifests as cardiac defects, cataracts, and deafness. Now in this image you can see the cataracts in a baby with congenital rubella syndrome. Rubella is one of the torch infections. It's the R in torch. It stands for rubella. And what cardiac defects are associated with congenital rubella infection? We mentioned specifically a patent ductus arteriosus and pulmonic stenosis. So remember that rubella causes significant congenital defects when it's acquired in utero, and it's a vaccine-preventable disease. The next viral family that we're going to discuss is coronavirus, which causes the common cold. Oh, bless you. That's quite a sneeze. What was the other virus that we saw that caused the common cold? That was rhinovirus. Rhinoviruses and coronaviruses are the two most common causes of the common cold. Definitely something to know. And then the other big players in the coronavirus family are the ones that cause SARS and MERS, which are associated with significant mortality. But I think that these are probably lower yield for your test. Then just briefly, I want to touch on one other family of RNA viruses before we take a break, and that's the retroviruses, which are the enveloped RNA viruses. HIV is probably the best known retrovirus, but we cover that in more depth in another micro video. HTLV is another RNA retrovirus. HTLV stands for human T-cell leukemia virus. So remember that HIV and HTLV are RNA retroviruses and that they use reverse transcriptase. So these are all the RNA viruses that we're going to cover in this video. We'll cover the rest of them in the next video. So go ahead and pause your video and complete that end of session quiz, and then we can go through the answers together. All right, let's get going. First question. What is the #1 cause of fatal infantile gastroenteritis? That's rotavirus. Next, what virus is commonly associated with outbreaks of gastroenteritis on cruise ships? Norovirus. Next, which RNA virus matches each of the following statements? The cause of hand, foot, and mouth disease is Coxsackie virus. Breakbone fever is dengue. Common colds, that can be rhinovirus, which is the most common cause. The second most common cause is coronavirus. Fever, jaundice, black vomit, or hemorrhagic disease and liver disease and renal disease, that's yellow fever. Meningitis in summer months, think about the enteroviruses here. Think about echovirus, particularly if it's associated with swimming pools, but also think of Coxsackie virus and other enteroviruses. Tourniquet test is the diagnostic used for hemorrhagic disease, and that's in dengue. And the virus that infects motor neurons of the anterior horn, that's both polio and West Nile virus. And that's it for our end of session quiz and for our video on RNA viruses part 1. I'll see you next time.